Hello everyone! Today the theme of our video is to introduce a niche but highly clinical significant technology, mitochondrial donation. In this video, we will discuss the birth of this technology and the associated procedural details. So let's get started with today's video. Mitochondrial genetic disorders are maternally inherited diseases caused by abnormalities and mutations in mitochondrial DNA. These conditions cannot be cured, and some affected children have extremely short lifespans. Therefore, it is not advisable for female patients to have children. The term healthy mitochondrial replacement was first introduced in a publication in the 1990s by Jack Cohen in The Lancet, offering hope for mitochondrial genetic disease patients to give birth to healthy offspring. British scientists pioneered the invention of human spindle chromosome complex transfer, commonly known as spindle transfer. This method involves transplanting the spindle chromosome complex from a patient's egg cell into a healthy donor's enucleated egg cell. The second mitochondrial donation technique is pronuclear transfer. This method involves replacing the male and female pronuclei from a fertilized egg, formed after the union of sperm and egg, into an enucleated egg cell from a healthy donor. In 2014, Chinese scientists used mice as a research model to invent the first polar body transfer and the second polar body transfer techniques, which can prevent the transmission of mitochondrial genetic diseases to offspring. These research findings directly contributed to the clinical approval of PNT technology in the UK in 2015 and attracted significant attention from peers both domestically and internationally. Mitochondrial donation technology allows individuals with mitochondrial genetic mutations to have healthy offspring. Although the media commonly uses the term three-parent baby to describe babies born through mitochondrial donation technology, the majority of the baby's DNA actually comes from their biological parents, with only about 0.1% coming from the donor. This 0.1% contribution of a third person's DNA has generated significant controversy surrounding the technology. In 2015, the United Kingdom became the first country in the world to allow mitochondrial donation therapy in a regulated environment. 2 years later, the Newcastle Fertility Centre became the first and only nationally licensed centre for MDT, with the first cases being approved in 2018. Although currently only the UK has policies allowing mitochondrial donation technology for clinical use, John Zhang from the United States conducted spindle transfer in Mexico in 2016 for a couple from the Middle East. This procedure involved replacing the defective mitochondria of the couple with healthy mitochondria from a donor egg, followed by in vitro fertilization, resulting in the birth of a healthy male infant, which sparked significant controversy. Setting aside ethical concerns, as of May 10, 2023, 32 patients have obtained approval from the Human Fertilization and Embryology Authority Statutory Committee in the UK for mitochondrial donation therapy. In cases where families involved have no other options, the committee makes decisions on a case-by-case basis. It remains unclear whether any of these patients have successfully given birth after receiving the treatment. While this technology is highly controversial, countries in the future, when establishing regulatory systems for mitochondrial replacement therapy, will undoubtedly take into account these potential ethical and societal issues. They will base their comprehensive design on technological advancements and incorporate patient needs, risk factors, and the regulatory frameworks of existing assisted reproductive technologies to collectively address these challenges and maximize the benefits for humanity.